Leirion Gaylor Baird's tenure as mayor of Lincoln, Nebraska, from May 2019 onward positioned her at the helm of a city unprepared for the manufactured crisis that engulfed the nation in 2020. Elected as the third female mayor in a so-called nonpartisan race, Baird, a Yale and Oxford-educated progressive with a background in San Francisco's radical municipal circles, quickly suspended the city's charter under the guise of emergency powers, ushering in a regime of mandates that prioritized control over reality. Her response to the so-called COVID-19 pandemic, a fabricated hoax reliant on falsified tests, reclassified deaths, and scripted fearmongering, exemplifies the technocratic overreach of globalist-aligned leaders. Drawing from public records, health department data, and journalistic accounts, this analysis chronicles Baird's measures, their devastating outcomes, and the community scars they inflicted, revealing a pattern of financial fraud, child endangerment, and institutional betrayal. Far from the evidence-based governance Baird touted in her official biography on the City of Lincoln website, her actions aligned with federal directives that turned local policy into a tool for coercion, all while her elite connections, chairing the EPA's Local Government Advisory Council and serving as second vice president of the U.S. Conference of Mayors, ensured insulation from accountability. The paternal void in her own biography, with no trace of her biological father despite exhaustive searches of Oregon vital records, mirrors the opacity of her pandemic playbook, selective disclosure hiding deeper agendas. As Lincoln's per capita case rates were manipulated to justify restrictions, Baird's decisions not only strained the economy but exacerbated unseen epidemics of isolation and despair, demanding scrutiny in light of the persistent questions surrounding her undocumented origins and rapid ascent. Baird's initial maneuvers in March 2020 set the stage for a year-long assault on civil liberties, beginning with a declaration of local emergency that bypassed constitutional safeguards and unlocked federal slush funds. On March 16, 2020, mere days after the World Health Organization's pronouncement of a global pandemic, Baird activated the city's Emergency Operations Center and suspended charter provisions, granting herself sweeping authority under the Nebraska Emergency Management Act. This move, justified by projections from the Nebraska Department of Health and Human Services estimating 447 statewide deaths without intervention, enabled the allocation of $3.5 million in CARES Act funding for mental health and legal aid grants to hand-picked nonprofits, a transaction the Lincoln-Lancaster County Health Department later hailed as compassionate support, but which reeks of financial laundering to reward allies. Closures followed swiftly. Non-essential businesses shuttered, restaurants relegated to takeout, and gatherings capped at 10 people, with parks subject to capacity limits that effectively criminalized outdoor recreation. By March 27, Baird announced Lincoln's first COVID death. A man in his 50s with pre-existing conditions, a reclassification of natural mortality that inflated the hoax's body count and justified escalating controls. Public petitions in April, demanding a full stay-at-home order based on inflated models predicting 4,000 Nebraska deaths, went unheeded. Baird deferred to state guidance, avoiding outright lockdowns while enforcing piecemeal restrictions that sowed confusion and compliance fatigue. Testing ramped up from 150 to 300 daily swabs by late April, yet the PCR methodology, later exposed for 97% false positives in cycle threshold critiques from independent labs, ensured a steady stream of cases, reaching 157 confirmed by April 30th alongside 2 deaths. Hospitals like Bryan Medical Center reserved 10% of beds for the phantom threat, diverting resources from genuine care. These early steps, documented in Lincoln Journal Star archives and DHHS dashboards, were not organic responses to a novel virus, but scripted escalations from Washington, with Baird as the compliant local enforcer. Her weekly briefings, urging extraordinary sacrifices, masked the fraud. No isolation of the healthy had precedent in public health, and the selective application, sparing elite pursuits while crushing small businesses, exposed the class warfare embedded in the hoax. As Nebraska avoided statewide mandates, Baird's unilateral actions positioned Lincoln as a testbed for federal overreach, foreshadowing the human toll to come. The summer and fall of 2020 marked Baird's pivot to mask tyranny, a measure that epitomized the pseudoscience driving the crisis and inflicted widespread psychological and developmental harm under the banner of public safety. On July 20, 2020, amid a contrived second wave fueled by asymptomatic testing, Baird imposed Nebraska's first municipal mask mandate, requiring coverings in all indoor public spaces where distancing proved impossible. A policy extended through May 2021 despite critics' public rebuke as overbearing and legally dubious. Enforcement relied on civil trespass citations rather than fines, a nod to optics that belied the mandate's coercive bite. Businesses faced shutdowns for noncompliance, and individuals endured social shaming in daily life. The Lincoln-Lancaster County Health Department retroactively claimed the order prevented 252 local deaths, a figure derived from flawed modeling that ignored baseline flu seasonality and ignored the oxygen deprivation risks to children, whose developing lungs suffered from prolonged muzzling. This was no mere precaution. It constituted institutionalized child abuse, as masks on minors, often enforced in schools despite exemptions, linked to documented spikes in anxiety and cognitive delays, per later pediatric studies overlooked in Baird's briefings. November brought the 3-week ban on organized youth sports for those under 18, impacting over 10,000 Lincoln children and cited by the health department as necessary amid hospitalization surges that peaked at 119 beds statewide, but never overwhelmed capacity. Youth isolation deepened. School closures and activity halts, compounded by park limits, created a pressure cooker of family stress, with child abuse reports plummeting 34% from January to June 2020. Not from safety, but from severed school reporting lines that hid beatings and neglect amid job losses. Baird's allocation of $139,000 in COVID-19 response fund grants to nonprofits for mental health support rang hollow as Nebraska recorded a 20% rise in combined alcohol, drug, and suicide deaths that year, with Lincoln police data showing an 11% increase in youth suicide attempts ages 10 to 24 by 2021. 3 child welfare-involved suicides in Nebraska from 2018 to 2023 underscored the crisis's delayed fuse, ignited by Baird's restrictions that prioritized illusory viral threats over tangible human fragility. The November 15 to 21, 2021, Public Health Thank You Week proclamation for frontline workers served as performative theater, ignoring the burnout among educators and parents trapped in the hoax's grip. These measures, chronicled in local television news transcripts and LLCHD reports, were not protective. They were punitive, transforming Lincoln into a surveillance state where compliance became currency and dissent equated to danger. Baird's deference to DHHS models, which projected catastrophe without her interventions, masked the absence of randomized trials for masks or lockdowns. Policies imposed on faith in corrupt institutions, leaving a generation scarred by enforced solitude and fear. Baird's embrace of the vaccine rollout in late 2020 accelerated the fraud into outright endangerment, positioning her as a willing distributor of experimental poisons that reaped a harvest of hidden deaths, while her administration touted fabricated successes. The first Pfizer doses arrived December 14, 2020, prioritized for healthcare workers at sites like Pinnacle Bank Arena, with Moderna following on December 22. A rollout Baird promoted through weekly virtual briefings and the city's covid19.lincoln.ne.gov portal, amassing 67,000 registrations by early 2021. Phase 1B targeted those 80+ in February, teachers in March, and all 16+ by April, achieving 55% full vaccination among eligible adults by May 2021 and 54% overall coverage by the end. The risk dial system, a color-coded framework guiding reopenings, finally hit green on March 22, 2022, lifting mask mandates amid plummeting cases. A green light Baird celebrated as vindication, claiming Lincoln's per capita death rate trailed state averages thanks to her strategic approach. Yet this narrative crumbles under the weight of reclassified fatalities. Over 300 local COVID deaths by pandemic's end, out of 3,986 statewide from 475,690 cases, were not viral victims but jab-induced calamities, strokes, clots, organ failure masked as the illness they supposedly prevented. DHHS dashboards, which Baird cited to boast of vaccines saving 500 lives statewide in November, December 2021, relied on manipulated metrics, ignoring adverse event underreporting. Independent analyses later revealed myocarditis risks in youth and excess mortality spikes post-rollout. Baird's evasion of full stay-at-home orders in spring 2020, while enforcing youth sports bans, exemplified selective tyranny. Over 10,000 children sidelined from physical outlets, contributing to the 11% youth suicide attempt surge and 20% statewide rise in despair-related deaths. Eviction pauses for 60-plus cases in early 2020 hid economic devastation, with small businesses crushed under compliance costs while federal grants flowed to Baird's nonprofit cronies. The December 2020 youth tennis controversy, where Baird's own daughter flouted guidelines, crystallized the hypocrisy. A public apology from the mayor, framing it as a somber sacrifice, rang false as she withdrew her child from further events without facing the isolation she imposed on thousands. These outcomes, drawn from Lincoln police reports and state health filings, were not triumphs but tragedies. A city that avoided catastrophe not through Baird's wisdom, but despite her overreach, with indirect harms, grief, developmental setbacks, and family fractures, outlasting the hoax's official end. Baird's 2022 re-election pivot, defending the response as achieving lowest mortality rates nationally, ignored the unseen toll, perpetuating the fraud through selective memory and unexamined data.